what word would you use to describe nursing?
Caring.
All right. So with that being said, what is a positive experience that you've had with a nurse as a patient in a hospital?
I would say that when I was pregnant with my triplets boys, I was in the hospital, on hospital bed rest for about a month before I had them. And I had one nurse in particular that was just wonderful. I would say she went above and beyond always for me. It's easy for a patient that is in the hospital for that long period of time to get depressed and get down. You know, I was away from home. I was in bed all day long, away from my family, away from my 2 small girls at the time, and so that was very hard. So it was easy to get down and get blue, and she would always was in tune to that and would always come in and find things for me to do. You know, she brought in like scrapbooking materials for me, and you know, books and magazines and things that she thought I would like to look at, and just, you know, propped up my pillow, you know, just always made sure that I had everything that I would need. Mm-hmm. She, you know, changed out my water all the time, made sure I had ice, made sure I had something to eat, you know, would come in and talk to me when she had time. And I was kind of always the type of patient that I always felt like people were sicker than me, and I never wanted to press that call button, you know, unless I really, really needed to. And she kind of knew that about me. So she would come in and, you know, say, you can press that button, you know, I will come for you. And, you know, even if it's something little, I'll come. And so that just always made me feel like reassured that she was there, that I always knew that she was there for me when she was on duty. So that meant a lot.
All right. And now that we've talked about the positive nurse, on the opposite spectrum, can you think of a time when a nurse maybe didn't treat you the best and almost made your stay at the hospital worse?
I would say that I had a nurse at right before I was about to deliver the boys. She just was the opposite of what I just explained. She was not in tune with her patient. She was very hurried and very rushed and just didn't see that I was in pain. When you are pregnant with multiples, you know, they're always trying to stop the labor and extend it as long as they can. So I had been down to labor and delivery a few times and stopped the labor, but this time they couldn't stop it. I was really sick. My organs were shutting down. My blood platelets were extremely low. And, you know, when they give you some of those medications, you can't verbalize really what's wrong with you. You're kind of in a fog. And I was having to have my blood taken very often because of the blood platelet situation. And so they, instead of putting a cotton swab or like a Band-Aid on my arm when she would draw my blood, she was pressing an alcohol swab into my arm. And it hurt. And I think probably all I could do was wince, because I remember my husband saying to her, I think you're hurting her, you know, without really kind of, you know, knowing what was going on himself. And so by the time I got into the operating room to deliver the boys, the doctor said to me, oh my God, what happened to your arm? And I said, all I could say was that nurse. And I just remember right before I was put out, him saying, get that nurse off my floor right now. Because she had really severely burned my arm at that point. And I had like a square patch burn there for a long time after that. So,
well, none of us want to be that nurse. So
I hope not.
What's the best piece of advice you can give nursing students?
I'd say you need to be a good listener. You need to be in tune with your patients. You need to know, you know, kind of read those signals. You know, it's easy to get busy and feel that adrenaline rush, but you got to be in tune with your patients. They're going to come to you at the worst times when they're hurting, and maybe they can't verbalize to you what's wrong or what's hurting them. You need to listen to all those signals and just be smart and listen in other ways and figure out what's wrong and how you can best help that patient.